Richard Engel from NBC News. You mentioned the iceberg analogy. An iceberg where 90% of it's below water. So the question is, do we have any sense of how big this iceberg is? And you mentioned earlier, we need to look at what the numbers are, but also what the numbers mean. So help us interpret these numbers. Now that China has just relaxed its classification system and made it easier for people on the ground to diagnose this disease, are we going to get a better sense of how big this epidemic is, how big the iceberg is?
Yeah, I'll pass to Oliver, you'll have more details, but in the absence of serology testing, a lot of countries, including Singapore, have done this. In China, it's been done as well, and in the special administrative region in Hong Kong, where in emergency rooms and as part of normal winter respiratory disease surveillance, they've been actively testing thousands of samples that are not suspect cases of COVID and of COVID. And at the moment, we're just not seeing COVID activity amongst those samples. So that would give an indication that the iceberg may not be that great. That's not a guarantee. But this idea that this iceberg is absolutely massive and in some way we're only detecting 1 or 2 or 5%, this is all based on modelling. This is based on certain assumptions around what's happening. And that those assumptions and those speculations are as valid as speculations in the other direction. But I sometimes find difficult to understand this by the assumption to the awful is the one that's accepted, and while the assumption of what might be a higher proportional detection of cases is always seen as invalid. I think we have work to do to see just how big that iceberg is. But if we look at the cases outside China, if we take away that issue, we've had well over 400 cases outside China. We've had 4 to 5 weeks now of cases being outside China. Only 22% of all the cases outside China are involved with local transmission in a second or onto a third country. 78% of cases still have a direct link to Wuhan or to China. And of all of those cases, and we've been tracking each and every one of them, we can only find 8 cases that are not linked in some way to one of the identified transmission chains. Now that doesn't mean that there aren't other chains out there, but that's what we're seeing. And all of the other data being collected from other surveillance systems isn't suggesting that there's widespread, efficient community transmission going on, either outside Wuhan or outside China. But without a serology test, that is very difficult to say with absolute certainty.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.